Here.
Mr. Benson.
Here.
Mrs. Edwards. Mr. Steingart. Ms. Vedder.
Here.
His book is here.
Okay, good morning, everybody. What I thought we'd do, if we could, Nancy, maybe we'll just start with Public Health Services.
Do they know that we're starting? They're all waiting up there.
Yeah, they need to be here.
Well, it is 11:15 for our 11 o'clock meeting, so.
Steingart in.
Okay.
If you ought to just grab a seat just so they can pick you. Yeah.
You can come sit at the table so we can
Nancy,
pick
could
her
you
up.
come, you don't have a handout for us, do you?
No.
Okay.
Starting on page 407 is where the Health Department Services budget
I'm
starts.
worried about getting something.
Oh, this should be brief, actually. Okay. What I requested to be on the agenda, it was just for a couple of minor issues, which I think have pretty much been resolved. The wages for our supervising public health nurse were included in one part of the budget, but not in another.
Hi, Marilyn.
But that'll be fixed. I just want to make sure that that's corrected when the budget is passed. That person we thought was going to retire, but has not. So we still need to fund that position and make sure that the wages are in there.
Which position is that, Nancy?
That is a 4010 33 148 supervising community health nurse.
Wait, what page are you on?
Public health starts on page 408 of the tentative budget.
Just give us the
What she
line
is.
number and the page number.
I have a different handout, so I have to go there.
As far as I tell, that's just an administrative issue that Janet's
It's an
gonna
administrative
address,
issue
so
that's being
I don't know that we
fixed.
gotta go too
Yeah.
deep into that.
And I want to thank the Office of Management and Budget and the Legislature for including my request for a public health educator in the budget. Marilyn, was that also, that was also an issue where the wages were included in one area but not in another?
Yeah, but that's gonna be correct.
And that's gonna be corrected.
Yeah, that's no problem.
To-
It was in the details section of the wages, but it wasn't put in the operating budget on the personal services line, but that's gonna be taken
Right,
care of.
so I just want to make sure that that's corrected in the
Oh,
budget
Andrew's
that's
here.
ultimately passed, because that position is very important and critical to improving the county health rankings. And we really actually could use about 5, but I'll settle for 1. The other thing I just wanted to mention, and I'm fine with this, is we did request funding for a quality improvement coordinator. I know we've talked about quality improvement and how important it is for public health to become accredited and to have a staff position for that, to do that work. It wasn't funded in the budget, it's a new position. However, I'm willing to work with existing staff that we have to try to make that work next week, or next year, I'm sorry. In order to, minimize the budget request. So, that's all I have to say.
Very good.
Yes. Specific questions for Nancy?
How are you able to bring down contract services by $500,000? Which is a good thing. I'm on page 408. I'm looking at the contract services with 8.7 million, and it's recommended 8.2, because we were talking about contracts in the last meeting.
What page are you on?
I'm on page 408.
Well, everything is reduced, right?
Nancy.
Federal aid.
408. Now, I'm just wondering how they were able to shave 500,000 off contract services, which is a good thing.
That has to do with the EI contracts that are taken over by the state.
Oh, that is a straight wash.
Yeah.
Okay, so it's,
Must be for the other.
Well, yeah, because you're not gonna get any
Yeah, exactly.
state aid, because the state itself is actually maintaining and paying those contracts.
so it's
and
not a savings.
It's a savings for us.
It's a shift in who's paying
Yeah.
for it. Yeah, I mean, we're still paying for it. but-
No, it's just which
But the
pocket
amount
it's
we
coming out of.
pay, right, and the amount we pay is so much more reduced.
I mean, if anything, we're reducing some administrative costs for handling all those contracts.
Yeah.
So it does come out somewhere.
specifics for Nancy? I think our budget's pretty much the same. Thank you.
Come in at a
Oh.
decrease of 9% over last year, so
How much is it?
a decrease of 9%
And you,
from our request last year.
you're down, you're planning on being down 3 people. Positions 81 in 2014, positions recommended in 2015 is 78, that's again on page 408. So,
I think some of it has to do with the reduction to your long-term home health care.
Oh, yes, thank
Populate,
you.
we've eliminated vacancies and shifted
Our
people, so I
long-term
think.
home health care program, we lost, first of all, we lost our community health worker program. We lost that grant, current funding was cut by the state. That was two people. And, changes to our long-term home health care program, as a result of Medicaid redesign, state making changes, going to manage long-term care. We had to lay off our personal care aides, so we had 4 positions.
There was 3 positions filled and 1 was vacant,
Yeah, 4, so that's 6 positions right there.
but are the people out there who were receiving the services, still somehow receiving
They're
services?
still receiving the services, it's been a shift in terms of, we still have contracts with licensed home care agencies who employ personal care aides. So those personal care aides all got jobs, and those services are still being provided to patients in the community. It's a shift in terms of who's
But
providing the
one of
service.
the concerns that had been in the past with the predecessor is, when you're dealing with outside agencies, they tend to, serve the busier areas, so like they'll serve Monticello, but they won't pick up Eldridge or the Manor or Williema, so are you finding that to happen?
Occasionally, yes, we are.
So how are we adjusting for the more rural people in need of these services?
We're almost always able to find a personal care aide or a service for a constituent, for a member of the public who, you know, usually we'll get a complaint and then we'll call and we'll work with the agency and say, look, this person needs this service. You have to find some coverage. And I don't know that anybody has gone without.
Okay.
Sometimes it's a negotiation and a pleading on our part.
So there was
For
never
the-
anything in
for
the
the patient.
contract that the level or the quality of service would remain in these areas that he's talking about?
I don't think the
No,
contract is
usually
that
the
specific.
contracts don't.
No.
Well, in Ulster they did, they made sure that the level of service wasn't gonna be reduced by, I wouldn't call it privatizing, but outsourcing.
I think that's a little bit of a different, situation. I think you're talking about certified home health agency. When other health departments have sold their CHAs, they have put in contract language to the organizations that you must continue to serve all the residents of the county. You can't just take those with insurance and not those who can't afford to pay. What we're talking about right now is our long-term home health care program, which is in transition statewide. It's a
Okay,
little
sorry
bit
about the
different, but,
confusion,
yeah.
But there is always that risk, like you said.
And we do advocate for.
So this is not addressing the CHOP,
No, no.
this is just
What we're
one-
talking about in terms of personal care aid program is specific to long-term home health. Keeping residents in their homes safely as long as possible in order to avoid the cost of nursing home placement. So those services are still being provided,
Thank you.
just not by us. We're providing the nursing care, and the other agencies are providing the direct contracts with the managed long-term care companies for physical therapy, occupational therapy, social work, and personal care aid service. That's how that's working.
So who monitors that now? Now that it's gone out of.
Well, our nurses are out there, seeing these patients still, and they're the primary, what you would call case manager. So if there's an issue, a concern, they advocate for their patients. So they will work with the managed care company and call them and say, look, this patient needs this service.
Thank you, Nancy.
Okay.
Appreciate,
Thank you.
I think we can, let's do the adult care center next, this way I think that's should be pretty quick.
Okay, do you have a seat?
That starts on page 574.
It was proposed in, the budget that we, change the role or the title of the nurse actually who's doing the nursing education or the program coordination to, officially the program coordinator title. But it was, left at RN. A program coordinator is very important in the facility. We spoke about briefly in the meeting before about, having staff adequately trained. We need someone who is designated to do this duty and have that person adequately trained, not only just in nursing, but that person has to train other staff in all of our mandatory issues that comes up. So we do need a program coordinator. I think it's on page 606.
Okay, wait, the IGT's gone down. Is that a typo? The inter-fund transfer? Isn't that the IGT job?
What are you thinking?
What are you looking at?
574.
No, interfund transfer is different than intergovernmental.
Okay, what is it?
The money the general fund sends to support the ACC.
And so how come it's,
Because we had a lot of rooms offline in 14 and 15. We're back to a new full year of the new facility and full operation.
Oh, I'm
When the
sorry,
IGT
then I'm a
was-
little confused. Because we were renovating, we had less rooms available. And that's why,
That's part of it, plus the intergovernmental transfers more in 15 and 14.
but since we're planning on filling the facility now, you would need the rooms available.
Right, so that means that's less that the general fund has to contribute.
Okay.
This is good.
Okay.
Not bad. Her
Okay.
revenues are up.
Hey.
If you listen to the last meeting, her revenues are up and her expenditures are down. What's so hard to understand?
Basically, the budget contemplates
Excuse me, Jane, I'm
mo-
thinking on a different level than you.
more or less, the
Obviously.
facility is somewhat self-sustaining based on this particular budget.
So we're ahead of the curve, we thought that would happen in 1 year.
Well, we're trying to get ahead of the curve. We are forward moving into, keeping the census. The difficult part is getting the census up. Once we get it up, it's easier to maintain. However, maintaining everything that we do here on going forward, our reimbursements from the state is reliant upon the service that we provide. Quality equals more funds from the government. It will improve our case mix index. So we need, so my petition is for the new position, which is on page 606, ACC program coordinator, to be, we requested it, but, it was not recommended. However, I would like to have a program coordinator. It's very important because if the staff are unable to provide good quality care to the resident because of lack of training or continued training, then it's going to impact on the care that is delivered, and it's going to impact our case mix index, which is how we're reimbursed by the state for individuals who are covered under Medicaid.
So is this a new position, or is
It
this
is
just
a
an
new-
upgrade?
It's an
of it?
upgrade. It's an upgrade.
So it's not new, it's just you're looking to upgrade
Upgrade
somebody from the
someone.
RN to,
Correct.
so it's the differential in the salary we're talking about, not a whole new.
Not a whole new.
You're talking about $5,000 now?
Yes.
Okay.
Just out of curiosity, be putting back on my RN hat. You're talking about getting somebody else to train your RNs. That is not an RN?
No, the RN who's the program coordinator is an RN.
She'll be an RN
She
and
is
she'll train more than just the RNs.
Correct.
Okay, I wanna make sure that you're still having at least a nurse.
Yes,
Training
absolutely.
the nurses.
Absolutely.
Okay.
Absolutely.
So
Right.
where does this intergovernmental transfer show up in this budget?
Page, hold on.
It is in.
No, they said that wasn't, that's not the same. That just came from.
It's on page 645 in the detail.
Where?
645.
On the detail pages, all the way at the bottom.
Say it the last,
4.2 mil,
The last-
4.22.
way at the bottom, Cora, 4.2,
Very last line.
say it.
Yes. Yeah, I see it, and the reason that we're getting more money from the state is because we're filling more beds or
No,
providing
No.
more beds?
no, that's
or-
just the formula-based revenue that,
Okay, so they've just decided to give us more money.
It's a pool of funds. It's a pool of funds,
Yeah.
yes. It's from a pool of funds. Yes. Whatever we're gonna be getting in by filling the beds is just revenue, it's just additional
Right.
revenue that we're creating.
Okay. See, one of the issues up until now that I've understood is that the IGT was, unreliable. I think that's a nice way of saying it. Because it wasn't necessarily coming in.
At this point, from what I can read, it's good for another 3 years. Past that, they're not guaranteeing anything.
And how
It would
far,
be up for
how far
renewal.
behind are they?
We've actually received 13-14, state fiscal year 13-14.
That's good, cause they
Yes,
weren't
that's very
that,
that's where that question about unreliability came, because they kept only doing it like 1 year at a time instead of giving you a multi-year commitment, so.
Yes.
And I think one of the things that worked in our favor is there's less nursing homes that participate, less county-owned facilities,
so
so
more money.
that you by default get more,
Right,
as long as they
less
keep the
Medicaid
pool as
beds
big.
and- yeah.
So we have that short window, basically, in which to be able to show what the true revenue is of the ACC, instead of always operating in the red.
And if we do increase our census continually and keep it up, we will improve in our revenues. It will come. If we keep the short term as a true revolving door, we will have increase in our revenues.
See,
As long as the short
The,
term
the
stays
kind of
full.
thing
Yes.
that's behind this all,
And,
my line
and
of
also,
questioning.
I'm sorry, go ahead.
No.
And also, if we improve our case mix index for our Medicaid population, we will also improve the amount of reimbursement we get. Because our
Right.
case mix index, that bottom number tells us per day, per person. Before we were given reimbursement by the service that we provide. Now they're giving us reimbursement by the quality of the service that we do provide.
Okay.
So,
I get it.
Well, that's why it was so important to get the grant money to redo the facility, because we knew that at some point the IGT may be cut off
Right.
at some point in the future. And so that we could still, as long as they're not in the red, you know what I mean, so, and it looks it's beautiful, and you're getting the kind of patients you wanna get and the payer that you want, so that's a good thing.
and as we keep on going in that
Right.
pathway, we will introduce new programs that will help our Medicaid add-ons, which will mean more money for those Medicaid, individual who are, they're considered custodial in the building. Not the Medicare that are the revolving door, but those who are fixed.
Cause one of the underlying issues that's been going on for I don't know how many years is to sell or not to sell. And a lot of it was, kind of masked by the fact that it was the IGT, as unreliable as it was, wasn't necessarily always being, rolled into the next year. But if, regardless of the IGT or not, the ACC can stand on its own, it won't be up for the chopping block every time. That's my concern,
if we do what we need to do as a facility, and excuse my terminology, but if we be that child that is in the home that actually fend for himself, then we will be viable. But if we don't fill beds, if we don't provide this excellent care to give us the benefits that are allotted to us through the provision of the federal government, then we will see ourselves on the chopping blocks. However, if we do increase the care that we provide, increase the census, and do the things that we are accountable to do, then we should be viable. The non-for-profit does it, the private sector does it, and they stay viable. Why can't we do it and stay viable as well?
Excellent.
You can.
So, in saying
The other unknown though is, in that what has to be watched this year is the short-term population in that census, because we have a 32 bed, right?
32 bed,
Unit.
short-term unit, correct.
And we're at what right now?
We're actually at 27 full in the short term.
And the average length of stay we're
Yeah.
experiencing is,
We are experiencing 21 days, and I'll tell you the reason for that. Many individuals comes into the nursing home, they have Medicare, but they don't have a secondary payer source. So they are actually not staying as long as they can stay to get the care that they need because they cannot afford the co-insurance. However, if individuals comes in and they are qualified for Medicaid, they can actually get Medicaid to compensate for the co-insurance that is needed, so they can have a longer stay. So that was one of the situations that I saw when I came on board, was that people are not really being given the length of stay that they need to get themselves truly back on their foot.
But would it be fair to say that 80% of your long-term patients are on Medicare and Medicaid? Would that be fair?
I would not say 80%.
70?
I would say more like 76%. And I'm just giving you a guesstimate based on what I have seen so far, and because I'm actually looking into the whole Medicaid population and looking at residents who don't have Medicare Part A and seeing why they don't have it.
Okay.
Did they not work? You know, these are things that I'm looking into because, and also looking at those who are veterans to see what other benefits are allotted to them through the VA, because there are additional benefits that are allotted to them, but people just don't know that they are entitled to other things.
but we're turning over that short-term population every month.
Yes, we are.
So
Every day we're having admissions and they're increasing every day. Every day, it's a revolving door, literally. Every day we're having admissions and discharges.
But overall, the picture, I think, is the brightest we've seen it, at least since I've been a legislator. So, you know, to whoever, everybody who's got all hands on deck,
Well,
we
the
really
staff,
appreciate it.
everyone is definitely, I
Appreciate
appreciate
that.
that. And I will relay the message to them because I do let them know how well they're doing because they are all working very hard. I do believe they're citizens of Sullivan County and they care a lot about the county facility, and I told them, this is your legacy, this is your inheritance, this is a part of you. It belongs to the county, you live in the county, it belongs to you. And I think they kinda understand that. So with that being said, I do need the staff in they talk about education and
We got
having
Extra
everyone
$5,000
educated,
now?
so we do need that.
Yeah, okay.
We got it.
We got it.
The other thing that I do need.
Wait a minute.
How many? How many?
Good, huh?
Just one.
It's
One
not,
of
and
the-
it's not a position, it's an upgrade.
Upgrade.
Right.
Because it,
It's
you know,
$5,000.
That's
dollars
fine.
per cost.
That's-
right?
we
So
got
be
it.
Clear, you're not,
Yeah.
Josh, are you keeping track of all of these on a
Sure is.
separate grid
Yes.
that you can hand out to us later?
Yes.
Cause I'm not.
That is. Okay.
The other thing that I am requesting, we have a very slim budget for marketing, or for advertising. We have $10,000. I think, since we got the marketer, we spent that $10,000. But the other portion of that $10,000 is gonna be going towards getting, things for our open house, which will be on the 11th of December. It will be from 3 to 6. We are targeting healthcare providers and hospitals, case workers in hospitals. And we need to put more in our effort where marketing is concerned. I understand that I understand our limitation because of the type of facility that we are, but I do believe that $10,000, even for a mom and pop store, is very slim. So for ACC, it's definitely.
So what would your number be if you could, there's a wish list, what would you want?
My wish list would be $100,000. Realistically, I know I'm not gonna get that, but I do need an increase.
I was thinking like 5 or 10, up to 100.
What I think may make sense and may help the board, going forward, is that the marketing part of this is really kind of gonna be a one-time, you need to get it out there, but probably not gonna be a reoccurring.
Right.
So if maybe you could put a marketing plan together and attach a budget to it, that's something that we probably could fund through, either a one-time line item as opposed to increasing the annual appropriations. But I think everybody would probably like to see a really thought out where you're gonna spend the money, when you're gonna spend it, where you're, and I think if you present that, I think you'd have a pretty good shot at getting board support.
You do need to maintain your marketing, and yes, you can have a big launch and get out there, but just to do it one time and not maintain it each year is a mistake.
It is definitely a mistake, and it's a waste of resources to just that.
So any marketing, you're not gonna get somebody with one hit, it takes several, and you keep on sending it, or it's not effective marketing, so.
But I agree with
good
Jonathan
point.
to have a separate marketing
Yeah.
plan, whether it's phased in 1 year, 2 or 3, but also to have a line for analysis like you talked about in the earlier meeting, so that you are clear on what's working and what's not working,
But
without that.
don't we want this by the 18th, so we can?
I mean, I don't think we necessarily need to, because
No?
I don't know that we're gonna, like I say, this year make it a operating, if
Should
it's
they
as
use it
successful
all?
as we hope it to be, next year that 74 would probably be reduced, and that could just be replaced to cover the marketing. So I think if we get it off the ground and you get the success that we all know should come from this, it'll kind of roll and evolve without changing the cost on the budget side.
But you said you've used all the money so far?
I think I've used pretty much most of it. We've allotted most of it out because we wanted to get things in for our marketing piece, like little tchotchkes and things of that sort. And we got table covers, formal table covers. We got brochures printed. We did the advertisement spread. All the advertisement that we're doing on the radio station and also in the papers were done through that line item that we had for marketing.
Are they giving a discount?
So would you say that?
Yes, we have gotten discounts.
Good.
Yes.
Would you say that now would be the time to keep that momentum going? Right?
Exactly, and that's
Instead of-
why I wanted to, do, we just started a radio, advertisement for the holiday seasons, and I wanted it to, be done, consecutively with everything else that we're doing, because it's keeping our name alive and keeping it out there. And I think that it is working. I do believe it is working because individuals, I've been to different, local, organizations, and they're telling me, the seniors are telling me that they heard us on the radio or saw us in the newspaper, and it makes a big difference, especially to individuals on the Western Front. They're going to Pennsylvania, they're going to, borderline facilities because they just don't know that we're there, because they're thinking, well, if I am going to look for my loved one on a Saturday, I could just go shopping in Pennsylvania. Liberty, what are you gonna do? What can we use to attract them to Liberty to say, okay, you could come to ACC, and we don't have anything to say as a leverage to say come to ACC, because you could, for lack of a better word, kill one bird with two stones.
Right.
Okay.
You got it, hey!
And also.
Otherwise you're beating up on the bird.
Exactly. And also,
We get
I
it.
noticed that we don't have any camera system in our building, and I am putting it out there, but I'm also going to look other funding, like look into grants that may be able to fund that for us. But we need cameras. It was not a line item in our budget this year, but we do need cameras in the building. We are in an area that we have wooded areas all around us, and I need to be able to feel comfortable as an administrator that besides the visual eyes, there's other protective or security measures in place.
You have a security guard there at night?
We have a safety monitor there at nights. They're on 24 hours a day, but they're primarily stationed in the lobby area. But what happened to the other entry points and exit points of the building?
Yeah, I think that's something that through the capital plan, that's a necessary
Yeah.
item we have to look at, because that's
And
with
then,
all that's
and
going
then
on.
we have the pond there too. So there's a lot of things that cause me to be concerned.
Well, thank you for bringing that up, and I just wanna say I'm excited about the changes that you've made, because the legislature's made a commitment to the adult care center as well, so.
Yes, thank
When I
you.
heard that the census was up this morning in Health and Family Services Committee, I was excited about that. How about Wi-Fi? Is Wi-Fi on the?
They're working on it. They're working on it. So far, what I have to do, I guess as administrator, you have to be a little bit creative and think outside the box. So, for the individuals who have, I have now a few residents who have business out in the community. They come into the facility. They need to keep their business viable. I appreciate them choosing us as a center, but, you know, if they're there and they're worried about their businesses back home, it does no good to them. You know, it doesn't create a healthy mind for healing. You know, so I think that having Wi-Fi, especially if we're going to market short-term rehab and see looking at those who may need short-term rehab, some of the younger population, some may be under 65, who probably are internet and tech savvy as well, may need to have Wi-Fi access. And I think that it's a good marketing leverage for us if we do get Wi-Fi in the building.
Is it a cost issue, or?
No, we're just waiting for the policy to go out.
Oh, policy.
The policy, correct.
Okay, is that on a time frame? Do you know?
Well, I did send out an email to see what the time frame was like. Haven't gotten a response yet, so, but I know they're actively working on it.
Okay,
But
Josh,
the
do you know?
sooner, the better.
The county attorney, and it's got some potential union issues if employees are using it, and disciplinary issues if they're abusing it. So we're trying to work through that stuff, but I'm hoping to have the policy on an agenda, executive or management and budget this month to have adopted. So assuming that gets all worked out and through, we'd be able to flip the switch on the 18th.
Well, I have a tentative proposal to make where that is concerned. If I, the administrator, and my fiscal officer get the access code, and we're the only ones who have it, if a resident come in, we can just put it on their device, and we can block it so that they won't see the code. It is hidden from them.
Yeah, we talked about
That could be a temporary solution until the policy can go out and then everything is open. And I think in and of itself, if someone comes in, I think even if we have the code for the access, it should be limited anyhow. It should not be given to everyone to give it out. It should be a few selected individual in the building who has access to it. And it's customary in other facilities as well.
Can I just have one more question? I know the Family Care Council has requested signage out and about. Do you have any update on that? I know-
We will have, we don't have the signage out as yet. We don't have the signage out.
Was that through DPW?
It's through DPW.
Josh, do you know anything about that?
The last I know, he got a quote. I'm trying to remember if that was public health or.
Some of the signages that were discussed has to go through DOT, I believe, and because one was proposed for on 17, the other on 52.
On Route 52, they're
Right,
both state roads.
I think the state roads, that is doable, because I think from my research, I think DPW, they do have a workshop that can make the signs.
Yeah, we have a
So,
sign shop.
yeah, so.
And I just wanna say I'm pleased about the cameras with the extra eyes. I think it's important with vulnerable people that,
Okay, that's my plea today. Thank you.
That was easy. Thank you.
Thank you. All right, Randy.
I don't know if everyone has met Dawn Cortez Lee. She's our senior FAO.
I know.
Nice to meet all of you.
Hi, I'm Anne Marie, I'm clerk to legislature.
You say that now, you don't know them all.
Okay.
I mean, you didn't include yourself in that role, but
Okay,
I said them, that includes us all.
if we can try to get through some of the quick stuff, I know the bulk of the discussion probably just gonna be centered around the employee part that we started to talk about last meeting, so if we can finish up with that piece. Is there any other areas of concern other than the employees?
It's been kind of troubling that one person is expected to do the commissioners, the deputy commissioner, and the division head job. Where are we with all that?
What,
I mean,
I didn't hear you, Cora, what'd you say?
that we're expecting one physical human being to do the commissioner, the deputy commissioner, and the division head job. Those are
Well,
three full-time jobs.
But Mr. Parker had the authority to fill the deputy position, I think, over a year ago, so that's not our calling, that's his.
Well, there was
I mean,
difficulties on.
He's had the permission from us to hire a deputy, so.
But the thinking, my understanding, correct me if I'm wrong on this, my understanding was that, we were not having three separate people doing essentially three full-time jobs. Commissioner, at this point, you know, we've given permission to fill, and the division head.
He's,
No, he has two heads.
I never said, yeah, but.
We've given permission to fill.
Yes.
Okay, yeah, okay.
But there's still, you know, it still seems to me that there should be two separate people doing the division and the deputy and the commissioner's jobs if they're two full-time positions.
That's the Randy to hire.
Right, so,
No,
so you're
she's
talking.
about two
Yeah.
things. He's
Yeah.
talking about, he has two
Yeah.
designations, besides the deputy.
So, I mean, is it the right time or place to just ask you, Randy, is that physically possible?
Which part?
So I guess.
It's always been done that way.
I guess history probably would give you, bring the discussion at least to start. So when they combined all of the stuff under Health and Human Services.
It was
right?
social and community mental hygiene
It
services.
was all brought together, and basically the division commissioner was one of the two super commissioners. They called him at one point. I know this was before Josh, but, so it was Judy Meyer?
Judy Meyer.
Was the first
Judy
one?
Meyer.
They weren't super commissioners. Richard and Harvey were super commissioners.
Okay, so I'm close.
Okay.
So they served as both the division commissioner, oral division, and the title's generally been held by the commissioner of family services. So they
Right.
do hold both titles, and that's kind of how it's been
Yes.
historically.
Yes.
There's no requirement, I think, to have a division-wide commissioner. That's just a title
It's a county.
under, you know, the county created item, so. So those are the two titles you're talking about, Cora, right? The division, the commissioner of the division versus the commissioner of family services. Which is the statutory state required title. You have to have a commissioner of family services
Right.
pursuant to state, right, Randy? That's
Correct.
that's the title.
Yeah.
Yeah,
The fact that we also call you the division commissioner, that's the county.
that's.
Right.
That's the county, right.
I guess the reason I bring it up is that it sort of came to a head when we had this, investigation for $49,999.99, in which, it became clear to me that there really isn't, if it was a cost savings that was done at one time, the extent to which those positions are reimbursed by the feds and the state, and we're actually being penny wise and pound foolish by not having that, so that, you know, we don't have these, you know, catch-up investigations and lists of things going wrong in a situation where other counties have three distinct people doing those jobs and getting things back into some kind of, you know, order, if
But
that's the right way to put it.
Yeah, the distinction on the job is if the division piece is for reporting purposes, not, so there is a head of public health, there's a head of community services, there is a commissioner of family services, so the division piece is really just a mechanism for reporting.
But I'd like to hear from Randy, because I really haven't had
Well,
this.
just in understanding the history a little bit, at one point in time, was there I know there was the commissioner and there was Commissioner Meyer.
No, Judy,
But
everybody
was there-
always served both roles.
Right.
Right.
But was there a deputy within the Department of Family Services and then a divisional deputy?
No, it was
Never
just
a
a
divisional
deputy director.
Because
Family
part of it in the budget, you know, there had been a job description at one point in time, a position that appeared to be a divisional deputy.
No.
I don't,
I don't
not that
think
I
so.
remember.
Probably left
Because
over
when I
from-
was up there, it was Jake Romo's commissioner, Jim Davis as deputy commissioner, but Jake was the commissioner of the Division of Health, Division of Social Community Mental Hygiene Services, and Richard LaCondra was the super commissioner who oversaw all of human services.
Okay,
In
so,
an ideal world, Cora, just to answer your question, right?
thank you.
If I served as in the capacity that I am now, and Kathy is right, I've had the deputy position vacant with permission to fill. I just have not been able to find someone. But in a ideal world where I think we could be the most productive and efficient in moving things forward, I think if there was, my position, an internal deputy, and a division-wide deputy, I think we could do much more than what we're doing, especially in, I look back to when I was hired in part of the interviews, and I really, when there were several interviews, and we talked about eliminating fraud, waste, and abuse, and we talked about no longer being a destination, a welfare destination, and I think we have accomplished that. But we also talked about streamlining services, consolidating services, and becoming more efficient and more effective. And whereas I think we have done quite a bit of work within the department, and I think with the Department of Family Services, and each department head has done quite a bit also with the ever-changing health insurance problems that are being caused. We still have not been able to, improve those efficiencies and look at things that maybe where we consolidate services and just get more efficient. So in an ideal world, if you asked me, I would say you have a commissioner, you have an internal deputy in the department, and a deputy in the division. I mean, I think
And those are
that's
3 separate individuals?
correct.
Okay, so,
Correct.
so that's the answer to my question. The second part of that question is how much of that is reimbursed by the feds and the state?
Well, within the Department of Family Services, obviously the commissioner there is going to, have that federal and state reimbursement. The deputy commissioner is also going to have the federal and state reimbursement. Theoretically, with a deputy for the division, you'd go into a 1/6. There's 6 departments in the division. Probably 1/6 of that deputy for the division would also be picked up with some federal and state. But then the other agencies would have to be, it'd be a chargeback situation within those other agencies. And I think as we, would move forward in a scenario where when we had Mr. Jesus, who had retired, who had, resigned, and, we're all real happy about Shanoy, and she tires me out just listening to her with her energy. That is a compliment, and she knows that. But in a situation where you have a divisional deputy, depending on the they could step in when a department head moves in, retires, because I think we are going to be faced over the next 2 to 3 years with the need to look at more consolidation. I just, we should continue to look at that. I think a deputy over the division would do that. But again, that's a wish list. And that was a honest answer to your question, Cora.
Well, I'd like, if you could, Janet, at some point, just give us a scenario or a couple of scenarios to crunch the actual numbers so that we know, for X amount of county share, we're getting Y and Z of federal and state share. And at some point, we can't,
Yeah, I can put that together.
pardon?
Yeah, I can put that together.
Yeah.
The problem is the funding in the other departments though, like, the ACC is not gonna be able to draw down additional funding to pay for their share. Cause it's basically revenues from, their bed days and, daycare, that type of thing. So it doesn't work the same as family services. But we can take a look at it.
just a couple of, broad brush strokes, because I think we're not gonna get out of the hole that we're in without 3 individual people doing 3 individual jobs.
I think the figures are probably actually within your budget, because what we had proposed in our budget, is, I had actually proposed to defund my deputy internally and to fund a divisional, deputy. Now, that's what we submitted to management and budget. What then was forwarded to you, I believe, was the defunding of the divisional deputy, and then the refunding of the internal DFS deputy. So I think those figures would be in your books possibly.
Does anybody know what?
But from a
page
priority
you're on?
perspective, which would you, I mean, if you had to do these in an order, would you do the divisional deputy or the deputy of family services first?
Right now, the deputy of family services.
Would be priority 1, and
Right.
then followed by when, if funding comes available, move
Right.
to a divisional deputy.
But I think within the department, I can, if I can focus on more things within the department, knowing I have a divisional deputy, then I can make other reductions within the department, which in turn lowers the local
Right.
cost within the department, which in turn helps maybe the general fund picking up some of the cost of the deputy.
So think like as a stepping stone, so if you were to get a good deputy in place, get them trained, get them going, the next step then would be
Right.
to maybe get this divisional
6
so that
months
free you
later,
up. So,
yes.
so timing wise, it would be really focused on making sure you get a solid player
So
in your
you
team.
have 2 potential candidates for the internal deputy, just hopefully by Christmas, I will know.
Good.
So I just wanna ask a question
Wait,
about.
Alan's been on
I'm
first
sorry.
then.
Just listening to the discussion, I mean, I don't think we should be held to what the structure was previously. If we're having recommendations from the commissioner for some restructures, I would look upon that favorably, and, I think this is an opportunity to kind of, take a look at the structure, better organize it, fit the mission of DFS, and so, I'm supportive to the concept.
Would you have to change the job descriptions for these people, or what, because I know we have job descriptions in place for your position and your deputies, so how would that work?
I think there is already, there is a job description already for a divisional deputy. Again, depending on if there was that position, who's to say that, one of the current department heads may not wanna serve in that capacity, and perhaps they could serve in that dual capacity, as a divisional deputy and a department head.
So you don't think you would have to change the job
I
description?
don't think so,
Okay.
no.
There's also
Cindy?
Director of Administrative Services up there when I was up there too.
Yeah, don't tell Vicky that.
Cindy?
I think I just wanted to address, a challenge maybe in the hiring process itself. I know we've had some discussions on, some of the deputy positions and where they actually are posted out, to get a wider reach for people that are qualified, because I think that was part of the challenge, was it not, that, trying to get qualified applicants and, they were, being screened for whatever reason, and by the time the pool was reviewed, you wind up with 2 candidates, and so what are we doing there? Is it a problem with funding through personnel for advertising, or what's the glitch there? Do we have a sense of?
It just seems for like higher level professional positions that we're not necessarily as, broad in our recruitment and our search of individuals. I mean, we're good at getting stuff out to NISAC, and to New York Public Welfare Association, but then we're pretty much limited to local newspaper, possibly on some websites.
So how can that be improved? Is that a budgetary issue?
I don't think it's much, I just think you gotta get down with HR and personnel, and if there's other outlets that you'd like to explore, just, no. Just explore those outlets with them, I don't think there's a limitation on.
Cause
they do that, if it's requested by the department head, they will advertise in other areas.
You know, if there's specific trade journals that you think you'd get a wider reach, then just, I would say, submit them. We've done that in the past,
So
but
that's
that's an
being
intern.
done currently? I mean,
We
Linda's
do it on a
not here,
case by
so-
case, I mean, but with some of the planning positions, we did that with Freda's position, we advertised in I mean, specific to the position, there's gonna be unique areas where you'd advertise, we did that with the nursing home administrator position, we advertised in
I think we need to create
specific.
a policy to do that, because what has happened in the past is that has not been advertised in where the, professional person would be looking for a potential job change. Those journals are not being accessed, whether it's the honor society journals, or the nursing journals, or the, engineer journals. There are professional organizations that for some reason, our personnel department does not, obviously wouldn't know all the professional journals that are read and which ones are just tossed on the side. Anybody in the profession, Alan's profession, this journal in my profession is good, this one I wouldn't bother with.
That's why
You know, I
it's,
mean, and
that's
that,
why
I
it's
think,
always been,
needs
the
to be
department head
formulated.
usually has
Right.
input
Right.
into that, so if there are specific areas that human resources wouldn't know, it's incumbent upon the
The
department
departments
that has that.
to work with
Right.
personnel to establish the automatic, these are the journals that I need it in, not, I don't have the money, I don't have the ability, I didn't get the
You're
funding for.
implying something, why,
Where's
did that happen?
It
No, I
has-
think, you know,
You're
for
She's
me,
not
you're
implying,
imply-
she's just.
for
She
me.
said it, that's not implying, you're right, she's not implying, she said it.
For me,
Well, I
it's,
have the issue.
you know, I don't know HR recruitment, right? I just, I don't. But I can tell you, you know, where to attract people who would be looking for this type of job, you know, in New York with the associations, et cetera. But when you look at the level of positions that the county itself is sometimes looking for, it's almost as if within your personnel department, you need a recruiter. You know, when you look at the positions that, you know, the county has filled in the last year to 2 years, you have filled attorneys, you have filled county managers, you have filled commissioners. I mean, these are higher level people that you want to be able to attract. I mean, how we ended up getting Shinoy was through, word of mouth and networking through word of mouth, et cetera, but, that's a time-consuming process also for a commissioner or a department head to kind of drop what you're doing and, you know, go to an association meeting, get the word out, get emails. But almost within personnel, if there's some kind of recruiter type of person for those professional level positions. And there are a fair number, you know, I'll call them professional, higher level, even in recruiting, Dawn. You're requiring people that require a specific, skill set.
So could I suggest that we have that discussion in personnel committee?
Yeah,
maybe
good
next
idea,
month?
Ira.
Yeah, okay.
That's right here, right, as soon
And
as we're done here.
I just wanna welcome you, Dawn.
Thank you.
37 minutes
Randy,
ago.
if you could just introduce Dawn, I know that, she's done a marvelous job from what I've heard, seamless transition.
Really?
I mean, we
You introduced
were
them.
very fortunate in being able to, you know, recruit Dawn, and Dawn had interviewed for another position with the county, and, I don't
You
know
got
what I
lucky.
would do, I don't know what I would do, you know, without her.
Were you from the area, I'm just curious?
I live in Sullivan County, yes.
No, I'm saying before, were you living here, or were you recruited into the
No,
county?
actually, I was living here and I was, commuting back and forth to Westchester.
But Dawn,
Thank
and
you.
Dawn has extensive municipal, you know, county experience background. And she's smart and strict and firm and supportive.
Good, very
Oh, you're just saying that because it's a public meeting.
No, no,
No, I'm just kidding.
Okay,
We needed a little break in
there's
tension.
no other, specific areas, I think I'd wanna move to the personnel, sheet that, Randy had. I think this is the area that,
Right.
seems to be the one you can spend the most time talking about.
I mean, what, just for a little, maybe just for a little history, very brief history, and that's the document where, from what we had budgeted in 2014, right, and
There's more if you really want one.
go in front, right? In 2014, and I'm gonna kind of break down between Medicaid, the Medicaid share, and then the rest of the DFS operating share. We had a total of 27,809,734. And 21,504 of that was Medicaid. This is on my own, I brought my own cheat sheet, just to kinda, so the number we were operating with in '24 was 27,809, right, 27,809,000. When our proposed budget that we submitted to management in budget was 29,215. So that was approximately a 1.3 or $4 million increase. Now that increase was all attributable to the IGT increase.
Is
okay?
Is
From,
2013 you're talking about? Or?
no, I'm talking about what we proposed in 15. So.
That was that extra 2 million somewhere.
So, what we then ended up with being submitted to you was a total of 28,656, a total of 22,800, or 22,400 of that was Medicaid IGT. So our part actually to administer DFS was then reduced $200,000. Okay, so we had, probably our biggest deviation within our budget for 15 was the proposal for, I believe it was 10 new positions within the Department of Family Services and the upgrading of 2 other positions. The local share of that would be $141,000. So what we have proposed today in this document, we even trimmed the number that we were proposing to add down, and we are still proposing that we can live within that local share recommended by management and budget to the legislature, adding these positions, but we would reduce from the safety net program. It was a $130,000 reduction. So that would cover the cost of the new positions. Now, I understand that, adding new positions on an annual basis, it's going to go up every year because of health insurance, because of retirement, but within that safety net program, whereas for 14, I think we budgeted, what did we budget in total?
Safety net, 3.7 million.
3.7 million, and as of November 30th, we're spending 2.9 million. So we think that there is a safety net within the safety net program. I mean, I would love to be able to come to you today and Dawn cautioned me in not doing it, but
So don't say anything.
perhaps my thought is we could probably reduce the safety net by $500,000 going into 15, but she had suggested I not, and I said, well, I'm gonna throw it out there anyways. I mean, it's
So where would that 130 be shaped, what?
from the safety net.
Yeah, but what is it that's coming out?
I mean, it's
We're spending less.
If we're spending less. So it's not any reduction in service, it's just we are spending less. We believe that money will be there at the end of the year. We would propose from what you allow us to budget, we would reduce it 130 to cover the cost of the new employees.
Can you
So
take
what
a-
would that 130 consist of?
It's just less spending on safety net expenses. So, can you take us through?
So basically you would turn it into billable things.
No.
Because the
No.
safety
They
net.
cut the spend, they budgeted, but they're not gonna use it.
We're not gonna use all that they budgeted.
In 14, we have 3.8 million budgeted, right? As of the end of November, we've spent 2.9 million. Okay, so in 14, you'll have 700,000 or 800,000. Now, maybe there will be another couple $100,000, outstanding expenses for December, but I feel that we will be about 500,000 below what we budgeted in the safety net.
Okay, So can you take us through then just these positions? Can you give us like an
Yeah.
idea what they would do and
Yeah.
what they're gonna accomplish so that keep it on task?
I'll start at the top with the full charge bookkeeper. Right now, in the Department of Family Services Finance Unit that has a, very large budget, we have a senior FAO, that is Dawn. Dawn has nine employees, direct reports, okay? There is really, with the 9 people, they all have different functions. Dawn has been working to streamline, cross-train as much as she can, but there really is no number 2 person within that finance department to, basically run the day-to-day, or to help with the 9 people. Having 9 people, 9 clerks, principal account clerks, etc., reporting directly to Dawn it's a big number. It's a high number. And I think, when Mary Marino retired, ideally in any organization, you want to have, somebody in the wings who can step up, right? In 10 or 15 years when Dawn decides to retire, the full charge bookkeeper logically, would be able to move up, hopefully at that time.
So you have no one now?
No, absolutely not.
The next one is the Social Services Data Control Coordinator. Okay, I cannot explain to you how many reports, management reports, different reports that are available for us to review data, to review performance within programs. Our whole vendor system, we created a policy that we put a kind of safeguard on it, but we need to do more, to be doing more with the vendors, with the application process, with the review process. This position would basically take over that vendor list and do that. There's also a very complicated case numbering system that in February of this past year, I told one of the top people in our resource unit, I said, please take over the number system for 30 days. Well, 9 months later, she's still doing it. And it's a necessary check and balance and something you have to have in the system, but that position would, those 2 functions primarily. The Assistant Employment and Training Director, that is really taking the new CWD folks, integrating some of our current examiners, and really developing that kind of high-level, top-notch employment program for the department. The chief is an upgrade of either a head examiner we have now or a principal examiner we have now to then, pick up to be the one over the temporary assistance program. The social services housing inspector is, I think, been talked about quite a bit. The assistant director of services, now, we have Vicki Saywall, who began in the position of director of services this past year after Barbara McKinney's retirement. In the past, within the department, and maybe Annie can help me with, there were 2 different administrators running the really family services upstairs. There really is a day-to-day operational. Vicki can sit in her office all day just navigating through the child protective reports, the foster care, the preventive, but then there is also a ton of administrative requirements, reports, things that need to be done. So that person is basically a operations person for our child welfare. That's the Assistant Director of Services.
They did have one up there.
That's $50,000.
Same title. Show it to us, so.
The other one, case supervisor, is an upgrade. That would be upgrading someone who's currently a senior caseworker doing, a fair level of supervision, that her position should really be upgraded to that of a case supervisor. The 2 preventive caseworkers are, with the filing of more petitions in family court, we're getting more removals of children into foster care, but we're also getting more court-ordered services for families, for kids who are still living at home with their mom and dad, to cooperate with our agency. Preventive is the unit that does the child protective monitoring or the court-ordered services for the agency. I think that's, and we had previously, I think there was an account clerk in there, that we can live without. There was a case aide in there that we removed, and then there was also a social welfare examiner in there that we removed.
And what about the contract medical?
The contract medical, remember a couple of months ago, we had increased from 5,000 to 10,000 with industrial medicine, medical associates. Those are the folks that are possibly unable to work because of medical conditions. Whereas right now, we're probably tinkering on spending 10. We really think, I think we had put in there budgeted, how much did we budget in there? 15?
15 and we were
15, and
reduced by
it was reduced by 6,000, so really, I mean, we have to, at times, send people for that independent medical, so whether it's kinda cut or not, we're probably gonna be coming back to you anyways, if it remains cut, to ask to reallocate funds during the year, because we do have to send folks for independent medical exams at times.
So Randy, getting to the point that Sandy brought up when she did the public comment, in terms of priority, other than saying every single position on this page, what would be the positions that would help with the error rate, reducing the percentage of errors that are currently being experienced in the audits?
You know, it's debatable on the error rate, and when things are called agency error, et cetera. Sometimes agency error is generated by clients not providing correct information. So a little bit agency error discussion is semantical, okay? And that,
Got it.
I don't necessarily wanna play it out, but, I mean, there was a lot of, reviewing the positions, looking at these positions, and really, and I know you said don't say all of them, but my belief is that we do need all of them to be able to provide the services we need to provide.
So are
And
these in a priority order?
No.
Okay.
And these
They're
are all in
actually-
DFS, right?
Yes.
Kathy, you had a question?
Okay, I have a
Go ahead,
couple.
Cindy.
Kathy, you wanna go?
Yeah, I have a couple, I'm gonna get my thoughts together. Okay, in 2013 and 14, we filled all your vacancies. Is that a fair statement? I mean, every time you
Correct.
came, we filled them all,
Yes.
okay.
None were denied.
Okay. Okay, now, so you're asking for 10 new positions that are not in your budget, correct?
Correct.
Okay. I gotta tell you right now, I'm gonna have a target on my back if we approve this.
They're all funded though, I mean, they're all.
Let me finish, and you can
Okay.
say whatever you want.
But I'm
Okay, I got
helping
this-
you with the
I got
target.
the stage now, okay. I've had probation here, I've had DPW here, I can't stripe my roads or fix my bridges because we're understaffed and we're underfunded. I have, every department in this building has probably asked Josh for additional staff because back in 2008, they were cut. So what kind of message do I send to my department heads and my other employees, let me finish, that I'm gonna give you 10 and they get none? I mean, I'm not done yet.
Okay.
Now, having said that, okay, so all the deadbeat dads were arrested and they're hopefully paying back the money they owe to whoever, okay. My second point is, you, just said earlier at the Cindy's meeting that, we've sent the message that this is in a welfare state, correct? And welfare county,
Destination,
okay, so,
right.
with all that said, I would think you would need less people and not more. So, I just wanna say that I understand that you say you need these positions, but as a legislator that represents all the employees in this county, I'm gonna be sending the probation department and my DPW workers and everybody else a bad message when I say I'm gonna give it to you, cause I have to live within my tax set, but I can't give it to them. So how would you answer that question?
Okay, I think, at one point in its day, the department had 225 employees.
My DPW had a couple hundred too, and then
Okay,
got,
right.
like
And I
200.
think,
Yeah.
what I have heard when I look at cuts that were made and cuts of positions that were 100% funded, and I asked, why were those positions cut? And what I hear is everyone had to feel the pain.
Right.
Okay, I think that kind of thought process and that kind of decision-making process put us in this position. I think that part of what people need to understand is that we are quasi-federal and state organization with reimbursement from the federal government and the state government to perform these functions. I mean, we differ in that, probation is a local function, okay? Whatever probation state reimbursement is, I'm sorry that it's not as good as it should be, but for these functions, I mean, if these were general fund functions, they would be a cost of $1 million to local taxpayers, but they're not. They're state and federal mandates and functions that we're meeting, and the share is very local. So I would ask you to maybe make a decision that's going to be unfavorable, politically, that, in explaining to the other departments or to constituents, but again, state and federal functions with high level of state and federal reimbursement. And we have been very conscientious with our budget. This is actually reducing our budget 1.6% from what we had last year, and I'm adding 10 positions.
But your division as a whole is in the red, correct? Your whole division?
Right, but
Okay, right.
if I can
But-
do the reorganizing and the streamlining and things like that, I think we can get
When my
that.
employees, they're not gonna care about the 1/3, they're gonna say, wow, 10 positions, that's their mindset. And you know what, whether it's state money or county money, it's somebody's money, and that's what the argument I'm gonna have to face, and my employees.
No, I appreciate it.
Well, I think that my argument would be that I think we can all recognize the issues in DFS. We're talking about DFS, which has the reimbursements. The rate of reimbursement is 10 positions, close to approximately $500,000, down to $100,000. With the reductions through safety net, there's no county share. So recognizing, I had the Health and Family Committee this morning. We heard from the public about issues, error rates, things like that. These are positions in DFS that I think in order to deliver the services in a better way, and with the work that fiscal's done, I think it's a necessary addition.
Safety net is 100% county cost.
71.
And it's something that we really don't have control. How consistent has the actual cost been over the last 5 years that you're comfortable with taking that out?
We have shown a decrease. You'll see increases in there in safety net, but I think since 12 and 13, you see that go down. Whereas before, with hundreds of people in motels at $1,200 a month, we're down to single digits of individuals in motels. Okay, I do not see, I had a discussion with Giselle, and, if certain people move on or are no longer here, I think your potential for homelessness to go up is higher. But, with everything in place we have now, Ira, I don't, in the next year, I don't see it going up. I see it going down, if anything.
And I think we could, there is some trending that you can see. The reason that it rose was the general economic conditions. There was a direct correlation between the direct impacts of sales tax dropping because the general economy dropped, which created more pressure on individuals that had needed assistance, and the safety net such. So I think as we climb out of this, we're seeing our sales tax and revenue increase. We're gonna see less pressure, hopefully, on the economic engines. You add to that some of the reforms that take place. I think the theory should hold
Well, that's all, I just don't wanna count on something and then regret it, and obviously if you're showing the trends and it's consistent, then I would be comfortable with, just pulling that out. It's just, I wanna make sure we're not making a mistake, and then the end of next year, we're short $200,000.
Well, I think part of the issue is also policy. My understanding, correct me if I'm wrong on this, Jonathan, was that the policy to put people in welfare motels was not dependent on the economic situation of 2008, that the welfare motels
Well, there's just more people coming through the door.
No, but
Where you house them,
the welfare motels became a permanent solution for what was not necessary. It was the wrong solution for the right situation.
right,
You know, so.
But it does correlate, I mean, it does correlate with the economy and.
Post 2008.
Yeah, you will see that, and you see that with our numbers, but, even with our number of folks receiving assistance now, again, it went down this past month, and it's the lowest it's been in a number of years, but you see food stamps go up, and you see Medicaid go up.
If you were to just classify, like, I don't know the titles as well, as you probably do, but how will this address the caseload issues and some of the performance-based? Are most of these gonna be more management supervisory, or are these gonna be direct frontline people?
The bottom one's the caseworkers, right? The caseworkers, address caseloads.
Okay.
Right? And those are court-ordered cases that, you know, we would be able to provide the service. The supervisor upgrade is someone who has to supervise a group of 6 or 7 caseworkers. The assistant director helps with the coordination of all of the programs, the child protective, the preventive, the foster care. The housing inspector is going to be out in the field. I'd imagine we wouldn't see him or her that much inspecting residences. The chief welfare examiner instituting, you know, that's more, you know, administrative in nature, supervisory, as is the assistant one. The data control is going to give us, we can look at trends, we can look at who's coming in, we can look at vendors, we can look at, you know, do all that work that we need to do on a lot of money that we're putting out there. And the bookkeeper obviously is financial in nature.
And then I guess the only thing I would ask maybe that, I know we had a discussion about the housing inspector as it related to, how much liability the county
Right.
then assumes, so.
Right.
Just maybe you could dig up, Tom, kind of some of that information just as a backdrop. So I know that was discussed at great length at one point in time in the past as to if we decide to do those services, how much and what kind of, how we have to structure that so that we do the right thing by the tenants, but also not put the county in jeopardy of.
And when was that position vacated?
It was a while ago.
Yeah, it was
Well,
Vince
Dick
Meyer.
Martinkovitz does it now, doesn't he? Does
That was
Dick
Vince
Martinkovitz go
Meyer.
out? Who said that Dick does
He
it?
does motels, but,
Yeah.
you know, we're down to basically 2 motels now, but Dick does do that for us. But we have to inspect foster homes.
Yep.
And then, you know, we would really, it's a double-edged sword on the inspector.
It's just a question of, you know, how do we best do it to achieve what everybody wants to get done, that's all.
There are options, be it hiring a vendor rather than having an in-house county employee. There was a discussion years ago when the position was terminated, I think by the resignation of the employee who held it at the time, whether that was something, and I did speak to the commissioner about speaking to OTTA and see whether that, the best way to handle that. And I'm happy to discuss that at whatever meeting you'd like to.
And also find out whether the contracted services are also reimbursable, right?
My understanding was that was part of the state's reluctance, is that they don't consider that a mandatory service, and I think the reimbursement will be nominal at best to that position. I unfortunately, if I recall correctly, some 5 years ago when I dealt with the then commissioner, that was, they never said it, but I think that was OTDA, the state's concern was that it was not a position that we had to perform. Henceforth, so they didn't want to reimburse. Plus, my concern from the county is that if we do it, we got to make sure we do it right. The gentleman who did it, I think, did a good job, but he wasn't a trained civil engineer or inspector, and that brings potential liability if someone gets hurt in a building that the county employee inspected. I, as a lawyer, that scares me a little bit, more than a little bit.
A lot.
Can I ask a question since I've had my hand
Well, I
up
think they would have to have
for a
some
long?
sort of pedigree, background, professional, and oftentimes situations of that level, we would hire a vendor perhaps and insulate the county by, you know, authorizing the same amount of money to the department, but perhaps having a vendor who insures and indemnifies the county is a way to eliminate some of the liability, if not all. I just found out about the position this morning, so I did discuss that with the commissioner just quickly, just so he was aware of my concerns, and, I don't know that that holds up the budgetary issue, whether we do it another way. That's not my call, obviously.
Yes, I have a couple of comments and or questions. I understand the piece of the housing inspector, but knowing that we're gonna put that on the side for the time being. I also understand Kathy's concern. We've funded everything that was asked for in the past, and asking for more when we have a blanket across all departments in need of more people. And I know that you're reimbursed, but there are organizations that are not reimbursed, that they have no way to be reimbursed, so we have to pick up that tab to keep this county whole as a community. So I guess my question is, these positions that are not funded now, are these jobs being done? That's piece number one. And I would suggest that you streamline some of this, because I personally cannot see funding 9 new positions within this department. So I'd suggest somehow,
10.
well, there was
No,
10.
2 or
and
3.
Right.
Let's let Katie finish.
Okay, so what I'm getting at is, if I was looking at this as a wish list, which obviously it is, it's not that you don't need it, but it is a wish list, I'd suggest you come up with your top 4 and come back to us, because I don't see how we can authorize in this meeting here and not in other meetings when other departments come forward. They all have large needs. So I'd suggest come back with your top 4. You know best what could be reorganized as far as the descriptions and the job duties. And then I definitely understand the need. Looking at our community as a whole, many people in the family services meeting had spoken out from public that it does need to be addressed, that it's not just all about fraud, and I get that. It is about services needed. So how you see having 4 funded to best serve at the present time. And then if we relook at it in the spring of the year, when the casinos are up and running, and we've got money pouring in, all
There's
well
no
and good.
casino in spring.
I don't think,
But-
no matter what happens. I don't think they have a call for it.
I mean, if there's some other way to look at this, I'd suggest revisit it and come back to us. with
And
a
I'm
limited-
proposing we let the commissioner do his job. I mean, there's so many concerns with DFS. This is covered through reimbursements. It's covered through the reduction that fiscal team worked out. I think this is gonna settle and improve a lot of the issues that I, as the chair, receive from employees down there. So I think we should move ahead with it. I wouldn't see any reason not to.
Any public comment? Stone?
The mention of, again, from this morning's meeting of Family Services, Health and Family Services, they brought up the point that if you can get more money out of cutting the waste in the big projects, the things that are costing the county on a daily basis and a monthly basis, instead of going after individuals and cutting programs that are safety net related, the same money that you are now asking for to make it work better could be taken by just somebody really sitting down, which people have, and analyzing a cheaper way to get the same or better product made up. So don't go into individuals and harass people, needy people on a lower level. Go after the big bucks, which comes from these big projects that aren't maybe sometimes completely reviewed, and to get the absolute best price. And I would very strongly urge the legislature to pay more attention to the recommendations from the county treasurer's office on a lot of these projects that maybe would have ideas to save money that could be used for what's being asked for right now.
Stone out.
Thank you, everybody.
Ken make it so
Oh, Ken, sorry.
Yeah, I got you one. 2 things as far as marketing goes, because part of it is, once upon it was Walnut Mountain Nursing Home. They very smartly changed it to Achieve. I think we should look to change our name, because adult care facility, or whatever you want to refer to it, is not as catchy and has some negative connotations to it. Achieve has done a very good job, especially on their rehab, and that carries the rest of the institution. And about Wi-Fi, it's a necessity. I don't care how you do it, it's a necessity. You wanna stay in touch with your friends and family. That's one of the things, when I went into Achieve, I wanted to make sure I had the second time. First time I couldn't make it work, but the second time it was there. And it's really critical if you wanna up that number in that facility, because people just gonna walk another direction.
Thank you.
I just have one question. Are we gonna receive a schedule of the departments coming in? Today we had a portion of the Division of Health and Family. Are we gonna have a schedule, and are we going to be able to get a summary such as we received today from the Commissioner on the department requests so we can review them ahead of time?
So,
Can we get
so
that?
next,
We only have 2 weeks.
Tuesday we have,
next Tuesday, there's another set of meetings which
Yeah.
are gonna cover the public safety, audit, and a couple of the other groups that had asked to
Real
come in,
property.
real property, and then we will have kind of the wrap-up next Thursday.
We did invite all departments from
Yeah,
the
not
division
everyone-
to come,
some
and
departments
some-
didn't have
some
issues with
declined.
that.
They didn't.
There was-
So today was supposed to be the whole Division of
Yeah.
Health and Family.
Yeah, like Youth
and-
Bureau didn't have any issues, Aging didn't have any issues, they didn't have anything.
We did.
Okay, so if there's ones that you wanna see come in,
Well, maybe we had some
let
questions.
Josh and, Michelle
Let
know
us
which
know who
ones
you
you
wanna
have,
talk to.
you'd like to have come, we'll have them come either Tuesday or Thursday.
Next
And
week.
then we'll, Janet, you can prepare kind of what's been requested by the departments that have been here and they kind of,
Yeah.
what would be a budget amendment format, so that everybody can look at those.
And
And
so
we'll
just-
discuss them on Thursday.
Okay, thank you. So just so I'm clear, the discussion that took place today, about this request for positions that are totally reimbursable and covered, when does that proposal get addressed?
So, what I think, if we get through most of the departmental stuff by Tuesday, and whatever little bit Thursday morning, we can then meet as the legislature and decide, how we wanna see the budget amendments put together, and then they'll get voted on the 18th at the executive committee.
Well, the way we did it last year was it was like you did a little grid, right,
Yeah.
Josh?
That's what I'm
Yeah,
saying.
they're technical, but we grouped them by we group all the ones for if you're doing these positions
Listen,
as,
10 to
here's
1,
all
so
the
when I
5
wrap this
amendments
up,
or
they're
6
gonna
amendments
slice
for this
the
one
pizza.
position, because you're hitting health benefits and a whole bunch of other stuff. So we'll have language in there so you'll be able to understand what each amendment is.
And then will you vote on it line by line, or if we have to swallow the whole thing?
Now, it's gonna be probably in some group of resolutions, I don't anticipate all being one, but the amendments, cause there's some technical amendments they have to make that are just, technical in nature that have to get done, so. But Thursday, we start to go through all what that stuff is, and then if we need to meet the Tuesday, the 16th, we can do that as well. As Nancy.
On your,
Aye.
I don't wanna prioritize your list, obviously, because it's not my department to do that, but a backup would be a wonderful thing. So often in civil service, somebody can't start a position until a month or 2 months. You walked in after, and now there's this huge learning curve. Especially with all the billing and everything that happens in that department, that's a real important one to think about replace or not putting in, because you want an easy transfer if something does happen.
And you also have a significantly large budget. All the forms that we have to submit to the federal and state government on a regular basis, you can fall behind very easily. When I started, we were approximately 6 months behind, and we're still trying to catch up on everything.
And
You really need somebody that you can rely on to step
It
in.
hurts the county's cash flow in that
That's right.
department when we don't have it. That's my point.
Yes.
Is it's not just them that are hurting, it's the county in whole, and it's our cash flow for them to do the billing that needs to be done properly.
So
and-
does that mean that the county is picking up like the payroll and all of that kind of stuff if the department is behind on their reimbursements?
Apples and oranges.
No, that's why I'm asking.
Reimbursements, you don't,
Yeah,
Basically,
it's
it's the cash flow
reimbursements.
that she's speaking about, the money coming into the county. If
Okay.
I don't file
Right.
my paperwork,
Right.
there's no money coming in.
These are the
It's all
reimbursements from the
paid
state
for.
and from
Yeah.
the feds.
But that's why I'm wondering how it impacts the
It
county's
impacts the
cash.
county in whole because it impacts
Because we don't have
flow.
cash.
Yeah.
Yes.
Thank you. So it doesn't affect payroll?
It affects all county expenses, not just payroll.
Okay.
Motion to adjourn?
Jean
Oh.
Kitty.
And the,
Thank you.
You're
Mark
off.
mentioned something about recruitment, and
I think so, raise my hand. Don't make me hurt you. What?
So you, in order to
We adjourn.
attract qualified people, you kind of have to extend your reach, your arms out to other areas. And a good source is Indeed.com. Most professionals go on that site. They don't. I'm a professional of various organizations, but I can tell you the honest truth. I've never really used my site to look for a job because most chances are there's not a lot there. But Indeed versus Monster and Career Builder is a better option for a good professional. They have a better screening process. It's a better search criteria and everything.
Try LinkedIn.
Okay, thank you.
That's a good site.